me, Alice is a licensed mental health counselor here in the US. I believe, as I told you, Ohio to be specific, and you
Yes.
practice in New York as well.
Ohio and New York,
And
licensed in Ohio and New York. Yeah.
oh, nice. Oh my gosh. We have a lot of our people, and I'm in Connecticut, by the way. And let us
Okay.
know where you're joining us from, guys. Where are you joining us from tonight, Friday Reset? So can you tell us, or maybe more like my curiosity, how did you get into the world of mental health? Your passion to serve the community here, and I mean, you are in Ohio, and you're licensed in New York City, but I'm Connecticut, and I'm like
Yeah.
and you're like, worldwide, so to speak, because
Yeah.
this internet street opens up,
Hmm.
the gates
Hmm.
more. So tell us a little bit about that, being that you're from Ghana, the same place I am, and your journey to be where you are right now.
So it wasn't like planned from childhood because like growing up, I never saw this as a career or professional option. So it was just, coming to the state, dealing with my own issues, family loss, things like that, that my family and I got to work with a social worker when my grandmother was in hospice. And that was interesting to me that, oh, like this is like a kind of work where people prepare families for death, or you talk to people about their feelings and stuff like that. So I was like, wow, this sounds like cool. And then I took an intro to psychology class and I really loved it. So, in the moment, it was really for myself to understand myself that, oh, I'm going to learn psychology, understand the human experience, why we do the things that we do. And then I got a bachelor's in psychology and women's studies. And then it was like, oh, you cannot really do anything with it. If you have a bachelor's in psychology and women's studies, like, what are you going to do? Then I was like, oh, then I have to think about career options. And I was like, oh, I remember that social worker. Maybe I want to talk to people. So then I chose the route of mental health. And as they say, the rest is history. And here I am today. Yeah.
Today, I love that. Yeah, I think our experiences truly shape our career choices too, a
Mm-hmm.
lot of times, for
Mm-hmm.
sure.
Mm-hmm.
I think we are
Yes.
similar, but mine was more like, having been here, I didn't realize till I was doing my rotation that I actually had trauma symptoms. Like when my preceptor at that time, Dr. Peacock, I like always talk about Dr. Peacock following him around inpatient. And he would talk to these patients and they would be talking about their symptoms. I'm like, oh, easily startled, or you get anxious, you get nightmares, night terrors, vivid
Mm-hmm.
dreams,
Mm-hmm.
and this and that. And the third, I'm like, oh, that's me right there. So that, more so than anything, opens my eyes to, because back home in our country, we don't really talk about, you know, this topic right here.
Yeah.
Talk
Mm-hmm.
about depression in such a way that if you say it once and they shame you, like you never go back to say you're depressed again. It's like, what's wrong
Yeah.
with you?
Yeah. Mm-hmm.
So,
Yeah.
which led to this topic today to talk about mental health in our Ghanaian communities, mental health, maybe a touch bit on African community in general, but because we are from Ghana, I want to like focus a little bit on that topic. What is your take on the state of mental health currently, 2025, in Ghana per se? Like not here, having been outside the
Yeah.
continent. What do you think it is like?
Yeah. So I just came from Ghana like a week ago. So that's great. And whenever we are having this topic, I just also want to just put it out there that there are therapists in Ghana who are doing amazing work with so
Wow.
limited infrastructure and limited resources. So even with what I was saying is, it is not an indication of the therapists who are in Ghana seeing people for less money, seeing people in such limited ways.
Wow.
But in Ghana, we still have a long way to go. Not only Ghana, but just the whole continent as a whole. Just this week, I was having a conversation in my comment session with somebody that they wanted to pursue psychology, and even with that, their parents were telling them that it is not like, how do you say it? It's not like a profession. It's not like an accredited or a distinguished profession like a doctor, an engineer, or a lawyer. So their parents were like, oh, and if you graduate, you are not going to get a job as well. So that just tells you the stigma in our community that even professionals who do this work, they are not seen as professionals, or they are not seen to be credible professionals. So that's just one part of it. And then the myth and the misconceptions around mental health.
Yeah.
It's the religion. People would rather see religious leaders than see mental health professionals when religious leaders do not have the education or the knowledge to really support people who are dealing with mental health issues and also like severe mental health issue. And then we also have to talk about the lack of research, right? In how our government doesn't invest in social sciences, in behavior health, like researching what does depression look like for Ghanaians? So, what does anxiety, trauma, those things look like for Ghanaians? What are the modalities that's going to help support Ghanaians? All of those things are not there. So, with the lack of research, that also means that the numbers are not there. So people can just say, oh, Ghanaians do not struggle with depression, or we are okay. And it's because there isn't the numbers to show. It's not that people are not struggling, but it's just because we are not really investing in it. So we don't know the numbers of people unaliving themselves, of anxiety, of how childhood trauma is impacting children at school. We don't know the numbers about ADHD, about autism, about neurological issues. So we don't know. And the fact that we don't know, I think sometimes it make it seem as if out of sight, out of mind, that it doesn't happen. So that's also an issue. And then also the lack of resources that when you go into our mental health facilities, Joy News did a documentary or a special
Mhm.
at the Pantine Hospital, and the state of the hospital is so appalling. There are no resources, there are no medication. Doctors have to use their own money to buy medication for people. It was just recently that with their national health insurance, people can use it for mental health. I don't know if it's been implemented, but it was announced. So I don't know if it's been implemented that people can use it for, I think, depression, anxiety, and I think severe mental illness. So there are so many things in our community that need to be looked at, and then it trickles down to the everyday people where the ordinary person doesn't acknowledge or doesn't really know mental health issues. So it's like, oh, it doesn't happen, or it's not real, or I
Right.
don't believe in it, or I'm just going to pray and everything is going to be all
Oh,
right.
right.
Mm-hmm.
Yeah. And yet you know, it continues. And it's such
Mm-hmm.
a good point because I remember sharing with excitement when I was going to get my master's in psychiatry specifically because you have the track of doing medicine versus psychiatry. And I remember that I was really, really heavy into um church life and stuff like that. And a couple of times, like not even once, a couple of times, it's like, oh yeah, well, you're just gonna deal with crazy people. And the first few times I felt like, I was defensive because I'm like, what do you, who do you call crazy people? Because it's just everyday people dealing with lifing. That's what it is. And then one other person said, well, if you're, taking care of all those people, don't you think you're going to eventually start being crazy as well? And I said, it just, the mindset, it's so I just learned to just not react, just take it in, sort of walk away, or just like acknowledge and like, yeah, you need some more education regarding what it is, and learning how our people don't even know how it feels like within our body when you observe a teenage girl not getting out of her room, or a teenage boy overly watching video games, being in his room or her room too long, and checking it to, or maybe they are lazy, and checking it to parenting styles such as like taking the door off the room, or corporal punishment, or yelling and screaming, or parental anger itself, their own crappy childhood being the conditioning that they've had, and chucking it to, oh, you're not going to be in this house and be all crazy, you're going to listen to me, that type of thing. What have you experienced? See, for me, being more of a prescriber side of things, I always say hat off to therapists that I work along and collaborate with. Because anytime I do therapy session, literally it takes me a whole like a week to recover, because you absorb
Mm,
so much of your
yeah,
client's energy. So I do more of the medication, which touch point on in a little bit. So prescribing, using medication as a tool beside therapy and all the therapies to heal ourselves.
yeah.
What have you seen? What are some of the impact of the way specifically our Ghanaians, right? Being how you painted the picture with how our mental health, no research, the numbers are not there, but how we show up for our children or not show up for our children, how we raise our children, and how does that impact
Yeah.
mental
So
health overall?
yeah. So like definitely, and I think that what you said, like it speaks to how people, each of us, like our strength, right? A lot of people talk about, oh, therapy seems to be difficult and all of those things, and I love therapy, right? Especially I love doing trauma therapy.
Yeah.
Somehow the things that drain people, for me, it's like, let's get in there, let's dig deeper, right? Let's peel back the onions and get, let's get messy. For me, I love doing that, so that's interesting. And as much as people do not, on the surface, really acknowledge mental health in our Ghanaian community. When I was in Ghana, I think something that I was able to do is work with some companies where they brought me in, working with their HR, where we did just basic mental health education. And during that education, it really opened my eye, or gave me that perspective that really, really, right, if we are going to kind of reduce the stigma, it's not just telling people to go to therapy, because sometimes people tell, go to therapy, but what am I going to therapy for? It's really the basic education that we need to give people. This is what anxiety looks like. This is what depression looks like. This is what, like, people were asking so many questions that for me as a professional, I'm like, oh, this is so simple. But for people, it was really real, right? They were asking these questions where they don't know, right? People were asking about dreams. So I had a dream. Um, does it mean that I have to go talk to my pastor? Does it mean that somebody's chasing me? And it's like, okay, is it a nightmare? Is it a night terror? What are you having? What is the content of your dream, and those kind of things? So it's not like, oh, it's maybe your family which is chasing you. I mean, sometimes they could chase you, but I don't know. But
It's
it's
subconscious.
yeah. It's more than that. So people really, I think people need the education, and also they need to see professionals, which is why for me I love doing the social media stuff, even though it's difficult sometimes. That there are times that for some Africans, for some Ghanaian people, I will be the first therapist that they would see in their life.
Right.
And that would be like, oh, so a Ghanaian can be a therapist. And I get that a lot. Oh, so a Ghanaian is a therapist, or Ghanaian can be a therapist. And it's such a rewarding moment for me. Like, yeah, Ghana can be a therapist. Let's talk, right? So I think
Exactly.
definitely the education, and also like mental health isn't so separate from who we are, right?
Of
It's not some
course.
outside entity that's out there that you have to believe in and all. Mental health and physical health and our biology, it's who we are. You cannot run away from it. You cannot say, I believe in it, I don't believe in it, or it's real, it's not. Even if you say it's not real, right? The intention behind you saying it's not real, that in of itself is your mental health. Or it's how you
Right.
grew up. It's your belief, right? It's who you are. So just making it sometimes really letting people know like, hey, whether you believe in it or not, it's who you are, right? You have testosterone, you have hormones, you have neurotransmitters, you have a brain, you have emotions, your endocrine system, you live in an environment, your endocrine system, you live in an environment, and physical health is mental health. We are talking about health in general. And as a person, you cannot say, oh, I believe in health. I don't believe in health. So sometimes just breaking it down for people and then letting them know maybe the types of it, how insidious it is, right? Again, because we don't have the numbers, it's easy for people to say, "Oh, my parents beat me or did this," and I turn out well. I'm good. Right?
Are you though?
It's so it's easy, right? They said the Nile is a river in Egypt or whatever. But
So
when again,
true.
if you're a therapist, you sit down with people, Africans, Ghanaians, you see the wound, you see the hurt, you see the pain, you see how adults are reparenting themselves. Adults are learning skills that children they should have learned when they were children. Right? Yeah. So that's sometimes that's what trauma therapy is about, right? Reparenting yourself, learning to be that parent to yourself,
Right.
having somebody
Absolutely.
teach you the things that your parents were not able to teach you. Now it doesn't mean they were terrible people, but it means they were not, right? Such as validating your feelings, such as somebody encouraging you to ask questions. Hey, ask questions, be curious about things. It's okay when you ask questions, you have the liberties. Just telling people you have a choice, right? You as a person, you have a choice. You make choices. What are you going to make that choice, or what are you going to do? Hey, um, you don't need to please everyone, right? Your love should come
Right.
with condition. You're not Jesus. You're not God. Even though them that did the unconditional love thing, what happened to them? Look at what we did to them. So
Right.
even them, they still have conditions. So it's like, okay, really teaching people the basic skills, and with therapy helping them that you be the parent to yourself, the parents that you should
Right.
have had. Now you are an adult, you could be that parent to
Yeah.
yourself. Yeah.
I just recognizing the patterns too, though, because there are
Mhm.
people who kind of just repeat the cycle. Truly,
Yeah.
this is what
Yeah.
we've known. This is how we do it. You know,
Yeah.
I say down like, oh, this is how we do it,
Yes,
or
this is
you know,
tradition, right? This is culture. Yeah.
right, right. It's so interesting because you absorb things and environments have such a big impact. I went to an appointment the other day, and I was sharing that in one of my videos. And when I said my name, the lady who worked the administrative personnel in the front, she kind of was like a little attitudey. But 10 years ago, Gina would have been maybe attitudey back, but be more enlightened. I was like being my, kind of like, hey, I try to have like little conversations or whatever. She brought me to the room, and then she came back. Like you can tell, like she's like a little like ready for, to. So she's like, "Hey, I saw your name. Are you a Ghanaian? My last name." And I said, "Yeah, I'm a Ghanaian." And I said, "Hey, nice to meet you." Whatever. We were talking about the weather, and so it's like, "Yeah, typically people, like she said, like people like your kind when they come in, they tend to be like maybe like angry. They present angry or very defensive, and she's coming in
Uh,
already prepared for battle. Like, because she's
okay.
knows they're gonna give her a hard time if this is
Yeah.
not working, or the appointment took a long time. They become very. And in that moment I reflected, like, and she was telling me a story of one of the ladies who eventually opened up. The lady had gone through a really traumatic time coming here to the US, and then kind of similar to my story, had gone through a divorce. But how many times as Africans, as Ghanaians, do we go through trauma, like even immigrating here based on how you immigrated here, right? People come in, sometimes not fluid. You come in, maybe you might struggle to get establishment, blah blah blah. I don't want to get too much of that, but you know what I mean. If you're a Ghanaian here, you get it. So that trauma can be on you, and you don't realize that people can even how your body, how you're presenting yourself, how you're even talking to people. If you get easily triggered, you fly off the handle easy. It almost seems like you're constantly have a lemon face, you're angry all the time. You're trying to manage the red bear you're seeing in the woods all the time. Do
Mhm.
you notice this to be true for women, especially? Men maybe have a way to numb it, maybe overworking, even using substances. That's another big thing I did a little research on. How much a lot of our men and young men are using marijuana to cope. It's really hush hush in our communities, using substances like cocaine, even opioid, but it's like very street. Alcohol, it's hugely, but it's like people smoke cigarettes, they go to church, they numb the anxiety, they feel the anxiety, can't identify what anxiety truly feels like.
Mhm.
But in
Mhm.
order to like present a certain way, they use substances differently. So this is the man part, but the women can present a little more like attitude, angry. They're like, "Are you
Yeah.
okay?" You say, "Okay."
Um,
"Why are you asking me I'm okay?" Da, 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 da. Like it turned to a fight real quick. Conflict mode all the time. Is it
yeah,
true? That the therapy movement had to do.
that's interesting, right? For me, when we are talking about Black women, I I often pause to call Black women angry or aggressive because, I mean, when you look at, if we're to take like a historical approach, we have every reason to be angry, right?
We don't rest. We don't get time to relax and read and be feminine. Sorry.
Yeah,
But I just wanted
yeah,
to project. Like,
yeah. And in addition to us not resting, we there is no expectation for us to rest, right? Like, you're born a Ghanaian girl, right from infancy, thereabout, you're being prepped for marriage and for motherhood, right? The
right?
way, girls are prepped. Sometimes I know in my culture, even though people praise waist beads and stuff like that, but it's really to shape a girl so that she will have some sort of, butt and look, feminine, and, just it's like she's being propped for the market, right? For the
Word.
market so that she'll be picked, right? So just, it's really like the conditioning really start from a very early age, right? If you don't take care, you are in a home with brothers, the boys can go play football, do whatever they want, but you are always expected to be in the kitchen, to be cooking, to be cleaning, to be, sometimes if you don't take care, you'll be washing, doing the laundry for your brothers. Like you'll be doing everything, right?
Not to mention
So,
waking up at 3 a.m. to start that. I've been there.
right. So, and sometimes even if you are not doing it, you are watching your mom or you are watching the female figure in your home doing it, and you can internalize that, right? And what women are called lazy, being told to dim yourself, right? Don't be too loud, don't I know when I was growing up, you don't have to wear, women who wore red nail polish, red lipstick. They have eyeshadow, they put on makeup, they do their hair a certain way, they wear a certain kind of clothes. Women who, let's say, they smoke. It wasn't really about their health, but it was about like this promiscuity. Oh, you're not the ladylike, or you're not feminine, or you'll be given a tag. So it's not really like, oh, you shouldn't smoke because it's not good for your health, but the
Mhm.
men can smoke, but you as a woman, you shouldn't really smoke that way, right? um when we talk about sexuality, girls are told to be pure, right? It's not really for their benefit. It's not like, hey. Yeah. So yeah, where was I? Okay. So yeah. So how definitely how girls are raised, it puts a lot of pressure, right, on girls, and then we grow up to become anxious. I think anxiety is one of the common thing that Ghanaian women struggle with. It manifests in so many different ways. Not being able to rest, not being able to accept compliment, not being able to even, sometimes just even accepting ourselves for who we are, right? Not being able to make choices in our life because if you were prepped and primed for marriage and for childhood, and then you grow up and you're not married and you don't have a child, and you are told that obadi and if the marriage is not coming, um, basically you failed, in life.
Yeah.
You failed the one thing that you were prepped for, or you failed to bring honor to your family. So yeah, so for women, it's a lot, right? And then our hormones, right? Puberty, adolescence, right? You go through it. Perimenopausal, I mean, like a perimenopausal state, and it's like, what's going on with my body, right? um, it's like the moment, you struggle through your 20s, now you get to 30s, you feel like, okay, I'm getting a hang of my body, I'm getting to know my body, I'm getting to know what my body feels like, and then perimenopausal comes in, and then menopause comes in. And for women in Ghana, for older women, menopause being a very difficult time for them. Some of them are branded as witches. It could be dementia. It could be them going through menopause, but they'll be taken to the witchcraft camp. Those things. So it's like, it's tough. Biologically, we are dealing with a lot, and then society wise, we are dealing with a lot, as well. Yeah.
Are those still there?
Yeah.
The witches camps
Yeah. In
in
the northern region. Yeah.
wow,
Hmm.
mind blowing. But we still have a lot of work to do.
Hmm. Hmm.
But the thing that's awesome is I think with social media, how it is it's slowly gaining traction in regards to acknowledging at least that oh, these are the components, and hopefully someday it will be a little more normalized as a counterpart. Caucasians will seek help for mental health services like that, where our people will wait and wait and wait. And besides depression, anxiety, people might be struggling with bipolar, might be
Yeah.
struggling
Yeah.
with schizophrenia, and those ones especially, or addiction, like people who are really, really into the sickness or disability of being addicted. It's like you're completely um, shunned, if so to speak. Those families are looked at, but there are families who might have struggles with high blood pressure, right?
Hmm.
Might have issues with cancers that run in the family, might
Hmm.
have issues with maybe pulmonary conditions. But
Hmm.
if there's a particular family where that, there's more depression is more prevalent, it's more like you guys are the
Yeah.
crazy ones. It goes
Yeah.
that way.
It's tagged. And I think, we are all a little crazy for, I'm using that word for lack of a better word.
Louder for the people at the back of the bus who can not hear you. For
We
real.
are all a little crazy in our own way, right? We are all a little psychotic in our own way. I mean, people listening, don't take it and run with me, because I know some of you will like to run with diagnosis, but we are all a little, we all have some level of anxiety, right? When you look at our fight, flight, and free responses, there is a functional to it. There is a function to it. Is the alarm of our body. So we all have that. We all have some sort of anxiety, that, there is a healthy dose of anxiety that we can deal with. We all struggle with insecurities, right? Low self confidence from time to time, right? If you're a person and you're going to be 100% confident all the time, there is something really wrong with you.
That's a whole different diagnosis as well.
Yeah, right. So it's
Yeah.
it's yeah, it's very fluid, and I think that's the thing that maybe people don't know about mental health, that it's very fluid, that we all have our struggles. Of course, it becomes clinical when it gets, you're not able to do your work, you're not able to function the day to day, then we can talk about the clinical aspect of it. But we all struggle, and often I tell people we are all one incident, one situation, one decision away from a psych ward, right? We, like, literally, all of us are towing the line of a psych ward. It's like a thin line, and I don't know what's gonna push me over the edge. You don't know what's gonna push you over the edge, but we are all there, right? Like, we could snap any moment, and you'd be like, but I just saw Alice talking, and like, and sometimes the people who are even in psychosis, there's a lady here on TikTok who is in a psychotic state, and she takes a shower, she has her makeup on, she has her lipstick on, she's very coherent. So if you're not careful, you wouldn't catch it until she says something, and you are like, wait a minute. Wait, wait a minute. I was really following what you said. Now, wait a minute. How did we get here? Right? So we all have our struggles. We all have our mental health struggles. And the people who, let's say, they are the psych ward or seeing a therapist, you're not better than them, or they are not inferior. Right? Yeah.
That's that part. The, you know, the differential in like people, hey, because I'm not there or I've never experienced that, therefore I'm here, and you are lower because maybe you've had an incident. You have a great point there, and we're touching base a little bit on EMDR. During the pandemic, I had opportunity to do a couple sessions of EMDR myself, my therapist, but it was remote, which was very, very interesting. she was pregnant, so we had to take a break because she had a baby, and then life happened, and then now I have to kind of go back to. But what led me to that was the height of my divorce, and like you said, sometimes it takes something to happen. So I drive a lot. I used to drive the highways. Nothing phases me. Okay. One day I'm going to a wedding, all dressed like all like nothing. Like I'm just feeling myself, ready to party, driving the highway. All of a sudden, I felt like everything was crashing on me. Like the world was, that was my first panic attack. I was shaking. I felt like if I tried to keep going, because my mind, I turned down the windows. I was shaking, I was sweating. I was like, what is going on? Because I've embodied so much of the stress, of the anxiety, of the separation, and then the divorce, the kids, the constant worry, the anxiety of what's gonna look like, the support. So, we talked about women, right? How we are conditioned. Like, I have to do everything to keep that thing going. But you can't keep something going when the other person doesn't. But anyway, going back to that, I was like, Gina, you need to pull back. You need to pull to the side of this road or you're going to lose your life, because that's how I felt. I'm like, if I
Yeah.
keep going or if I don't stop, I'm going to
Yeah.
be over, because I was shaking. I was all, so I pulled over. I called my friend to pick me up, and then I got AAA to get me away. And then when I got home, I was like, oh my God, I'm shaking. I'm like, this is how? Like, what was that? Ever since then, like I'm starting to take classes back to re-expose myself to highways. I'll take certain highways, but not like the main highways that go to
Yeah.
New York, stuff like that.
Yeah.
That still brings back that anxiety. But something changed in that
Mm-hmm.
moment. Even when I'm going with my driver to do the exposure therapy, I still have that panic. And she's like, breathe through it. You're gonna be all right. There are other people, and he will normalize, like, there are people who also have gone through that. And him saying that, I'm like, oh, thank you. I love you so much. I'm like, I felt like I was the only one. It's like, don't worry. This like older white guy. And he's like, let's go, let's do it. Keep doing it. Try to do at least once a week or twice a week. And slowly you're gonna regain that skill back. So it's like rebuilding it. And I share that to say, EMDR, when I started doing, I'm like, I noticed a big difference. For me, talking in therapy helps because I'm a talker. I talk your ears off. But building skill helps me more. Like hearing what I hear, but knowing what to do with it. Like, what do I do with it? Because I get anxious. So tell us a little bit. How does EMDR help to rewire when we have gone through such trauma? We think about trauma as, you've gone through war or you've seen gunshots, which people actually also experience that on top of some, I call it my small T traumas and the big T traumas. And sometimes some of us have a mixture of it. How does you utilizing the modality of EMDR help people like myself and many of the people here tonight to heal our trauma and trauma experiences and what happened to us?
So EMDR is eye movement desensitization
Mm,
reprocessing.
mm,
Kind of like a big long name. So in terms of the eye movement, it's not really eye movement, but it's really bilateral stimulation. And what bilateral stimulation is, we are trying to stimulate both sides of your brain. And we are trying to stimulate both sides of your brain because when trauma or stressful things happen, it shuts off the frontal lobe. So in a way, we are not really processing what is happening, and it gets stuck in the emotional, or we would say maybe the limbic part of our brain. And in that, the processing. So I'm gonna say a couple of words. You will follow me. If it becomes ooh, put it in the comment section, and I'll pull back and I will explain. So the theory behind EMDR is called adaptive information processing, AIP. And the adaptive information processing, really, it's like our brain is like a filing cabinet, right? A
mm,
computer that works. And Our brain is a very simple machine. It's not that complicated. It has the job, one job to keep us alive. That's it, right? Our brain is not here to do all those complicated things. We humans, we decide to do it. Biologically, the brain's job is to make sure that you stay alive, you are safe, that's it. Now, whatever you want to do, go do it. But the brain has to do its job. So, in that, it's also kind of doing some information processing, right? Information comes in, it processes the information, it stores some of it in the short-term memory, it stores some of it in the long-term memory, some goes into your unconscious, whatever it's not needed, it kind of like throws it out, right? So it's like an assembly line. Everybody knows the job that it has to do. Everybody knows the job that it has to do. Now here comes trauma, right?
Mm.
Trauma causes a glitch in the system. So there is a disruption in the processing. So somehow the information is not being processed and it gets stuck somewhere. And when it gets stuck somewhere, it distorts kind of because the information is not it's not processed correctly, it's distorted. So that's why sometimes you can get triggers, you can feel like the thing is really happening all over again. You do things that doesn't really make sense to you, risky behaviors, self-sabotaging relationships, doing things that's like, right, does this make sense? This doesn't make sense. That's also the reason why when people are in an active traumatic situation, they are also not able to make better choices. Like in an abusive relationship, all of these things, people will say, why don't you leave? Or you are the outside, you be like, okay, leaving is the best thing for you to do here. And the person, maybe they will make excuses and you're like, you're really dumb or you're really stupid. Like, I can see it. Why can't you see it? But the frontal lobe is really off. So it's
Wow.
being shut off. So that's what really trauma does. So let's say when the glitch happens, the information is stuck there, right? So sometimes you could date trauma happens at maybe 5, right? The information is still stuck in the 5-year-old brain or
Right.
5-year-old self, but you are an adult.
Right.
But
Right.
sometimes, some of your emotional reaction to things is like, you are 40. Why are you acting like you're 2? Like, emo- emotionally, you are 2, or emotionally, you are 3 right now. Like, the way you are acting in this situation,
Take it all the way
you're
back.
not acting like an adult here. So that's also part of it, right? And the other part of it is also when trauma happens when you are a child, because you're still developing language, you're still developing your insight, you may not have the language to describe what really happened to you. But your body knows, right? You know the experience, you know the sensations, but you cannot really say, this is what happens to me. So all of this is part of what EMDR wants to do. We want to move the information, we want to move the information along and process it, right? So that it can get through wherever the clog and whatever the disruption is, get through the frontal lobe so that you can process it, have a new experience in like a very controlled environment with somebody there with you. So EMDR, it's definitely for trauma, but it's also known for other modality, other sort of clinical presentations. If you want to make a decision, if you're struggling with things, it can really help you. So
I like
it's in
that.
8 different phases. 8 phases. It doesn't go phase 1, phase 2. Like most experiential things, it goes all together.
Mm.
But the goal is to use bilateral stimulation to desensitize the memory of what happened to you. So part of it because, again, there is a distortion. You may have a distorted view or belief about yourself. So we could be talking about a situation, right? You could come in and be like, oh, it's difficult for me to get into a relationship, or when I get into a relationship, things happen. We would talk about it. We would talk about it. Then it will come up like, oh, you know, then the person could say, oh, I am so terrible, or I am so unlovable, right? That is a belief right there. So in that, we are capturing that belief. And the question would be, okay, now you're saying you're so unlovable. Okay, when is the first time in your life you believed you are unlovable? So we are really getting to that first memory
Right.
of when that came up. And then we would ask, okay, when is the worst time you believed I am unlovable? And then we would get that. And then when is the most recent time you believed I am unlovable? So in a way, we've collected three memories and we are going to process that memory. And so when you look at it with EMDR, we are really getting to that first memory and really processing that first memory. So it is that specific memory that we are going to desensitize. So after collecting that memory, again, it can look zigzag all over the place. After collecting that memory, we are now going to focus on that memory. So this is the memory that we are going to work on. Okay. This memory, we will talk about it a little bit based on what the person want to talk about. If they don't want to talk about it, it's fine. What is, as you think about this memory, what is the worst part of this memory? It could
Right.
be an image, it could be a sensation, it could be whatever you remember, right? So some people, if it's a childhood trauma, they could say, oh, the look, I could see my parents look. It looks like they were very disappointed in me. Okay. So we will capture that. We are going to process that. Now, if the negative belief is I am unlovable, the next thing that we would do is, okay, looking back on the memory now, right? What would you like to believe about yourself? It's what would you like to believe about yourself? It's not what do you believe about yourself now, but what would you like, right? So it's very aspirational because we are going to process it. So you don't really have to believe it, but it's something that you would like to believe about yourself. Then we will collect that. Then we will collect what is called VOC. How much do you believe this on a scale of 1 to 7? You say it. What emotions are coming up? So we are really trying to activate things, right? As you think about this memory, what emotions are coming up for you? And in that, right, there are a lot of people who don't know emotions. So what I do is when it gets to that point, whether I'm doing virtual or in person, I'll pull the feelings wheel out, give it to the person, what emotions are coming up for you. Then they could identify. We'll put it down, we'll do a body scan, and then we will move into the desensitization, which is, now bring up the memory, bring up the negative belief, bring up the body sensations, all of these things, and then we would do the bilateral stimulation. So the bilateral stimulation is what the EM is, right? Eye movement. So some people do the eye movement, right? Some people do tapping, so alternate tapping. Some people do the alternate tapping on their thighs, right? Now with technology, there are buzzies that people could hold in their hand that it could activate the bilateral stimulation. Some people could do sound, so there are sounds that could do bing, 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 bing. Again, activate the bilateral stimulation. So we will go through the bilateral stimulation. You do it 30 to 40 seconds. I'll say take a breath. So again, take a breath. Taking a breath really, because if let's say you are in the memory and you are processing it, you can get activated. So take a breath. That's why we are not doing it for a long time, right? So if a person is also processing it for a long time, ADHD, your brain could move somewhere else. So that's why it's also 30 seconds. So it's in smaller chunks so that you'll be able to keep it present, right? So take a breath. The person would take a breath. What are you getting? Okay, that's fine. What are you getting? They will say, oh, maybe this and this is coming up about the memory. Okay, go with that. Then they will do the bilateral stimulation, 30 seconds, pause, take a breath. What are you noticing? Go with that, go with that. So I think the thing about EMDR that I like is that you don't have to explain your trauma to anyone.
I like that.
I am not trying to make your trauma make sense to you. I'm not doing any of that. I'm not providing any interpretation. I'm not doing anything. You are processing that memory all by yourself, right? What you see, the bilateral stimulation, you are doing that all by yourself. I am just a guide, a person in the room with you, giving you the prompt, telling you to pause, going with it. So really people are able to, I think it helps. Again, we are rewiring the brain. And so you are getting new insight, right? Sometimes people can get clarity that, oh, when this happened, I really thought I was alone. But now that I've really had time to look at the memory, there was somebody there with me, or it didn't really happen as I thought it happened, or it wasn't that really serious. When I'm processing, it doesn't. Sometimes some clients will be like, Alice, this doesn't make sense. Then they will be able, they'll be like, let me tell you this. Does this make sense to you, Alice? I'm like, I don't know. Does it make sense to you? Like, you are the one that came to therapy, like you're struggling with this thing. Now you're telling me this doesn't make sense. What do you mean? Right? So people are able to do that. And sometimes also it gives them the ability to look at their trauma from a bigger picture. So sometimes you could be like, oh, Alice, you know what? I was a child. I was a child. I couldn't defend myself. I wasn't in control, but now I am an adult. Something like that can never happen to me again, or the likelihood of something like this happening is zero. I don't even never happen to me again, or the likelihood of something like this happening is zero. I don't even know to protect myself, or you're like, you know what? I have friends. Why did I think I'm alone? So really, again, you're really structuring the brain because you are able to process it, right? You're not talking about it, but the bilateral stimulation and also whether you're doing tapping while keeping your body in the present as doing the body scan is really helping you to process that trauma. So when we finish processing that past memory, we go to process a future scenario with a positive belief. So we'll be like, you have your positive belief that you want to work on, you've worked on it. Now we'll get to the future belief like, okay, with this positive belief, right? What is a situation that is likely to come up in the future that this positive belief can assist you or can serve you? And then we will process it. So, in a way, you gain some sort of confidence that you have so many different intervals and opportunities to process this thing that has happened to you, to make sense of it, and then to deal with it. Now, it sounds all good and all of that, but also EMDR doesn't work for everyone, right? It doesn't work for everyone. We have to talk about it that some people, um, I found that if you haven't been to therapy before, you may not be ready for EMDR because we are delving into trauma, right? So um, it means that we are going to do a lot of work at the front end. If you don't have your coping skills, if you even don't know that you have experienced something, so sometimes talk therapy preps people for EMDR, where you have your coping skills, where you know how to do certain things that EMDR kind of, becomes like, okay, I'm ready to process this trauma.
Hmm.
Neurodivergent people, I found that people with autism or autistic people, I have to really tailor it for them. So sometimes it becomes difficult. People in psychotic state, EMDR isn't going to work for them because again, psychosis, we are really dealing with a neurological and a biological
Hmm.
thing. So you cannot be really in that mindset to process it, right? And also because we are rewiring the brain, you have to be careful with what you are rewiring the brain with. So we don't
Right.
want to rewire the brain with psychosis or something that's psychotic or
Yeah.
that's not true, right? So we don't want that to be what maybe you're replacing things with. So
Right.
yeah, so those kind of things that you have to really be in a very stable place,
Hmm.
well resourced. I mean, we do resourcing, a lot of visualization, a lot of meditation, those kind of things to really help people to process that. So that's like the long story of
I love
EMDR,
that.
and I'm going to turn my light on, but I can hear you.
Yeah. That is such an amazing breakdown of it in that way. Um, Guys, leave us a comment in the chat box. Have you heard of, have you experienced EMDR? What has your experience been like in the past regarding therapy, healing, and wondering, does how many sessions, or do you tailor sessions to each person differently? Is there a certain number of sessions, and is this a modality? Do you see clients outside of the US? Do you see clients like Ghana, for example? If I know a friend or a family
Oh,
member who
so
needs services?
um yeah, so I think, it's
I
so
didn't hear this. It's
I
like,
see client I
need
see
this.
clients licensed for like the first license for Ohio and New York, right? And I pause because I am like in I'm like in a really transition place in my profession, in my career now, where um I mean, as of Monday, I'm going to be unemployed. So I have to think about what I'm going to do, right? Am I going to go into private practice, work for myself, or am I going to look for a 9 to 5? So that's why I paused when you said that I am in a place of transition where I mean, for the first time in my life, I don't know what I'm going to do for work. I don't have a job lined up, and it's so weird. But so I'm licensed in Ohio and New York, right? So EMDR can be done weekly, right? We also have EMDR intensive. So that's 2 to 4 hours a day, 3 times a week.
Oh, okay.
So that one it could be for maybe that one it's very specific. So for the intensive, people really have to know what they are going to process. So it could be that maybe somebody is preparing for a baby, right? Preparing to get married, preparing for maybe a job promotion, or they preparing for something, a milestone in their life where they're like, okay, I want to come in, I want to do this, right? So for the intensive, usually for a month. So that means you're doing therapy every week, 3 times a week for a whole month. So that can be a lot, right? But you get to finish. It's like an accelerated way of doing things, right? So the month is like the minimum, right? But other things could come up,
Exactly.
right? So other things. So and then there is the weekly EMDR that it's weekly, an hour, right? That. that could take time, right? Weekly, an hour. In the week, I found that when it's weekly an hour, things come up. So sometimes when people come in, they want to talk about their week. Um, and
Oh,
then we would have only about 30 minutes for EMDR. So that could be really slow, the EMDR process versus the intensive. So that's that. In terms of outside, I mean, I know in the US you cannot practice where you're not licensed. I know in Ghana and outside the country it's different. That so I really have to think about it, right? Is it going to be called? There is a possibility that I would do it, but also it also has to be a lot of screening have to go into
right.
it, right? So making sure that the risk level is very, very low. People are well resourced and stuff like that. So also in terms of that, it cannot be called EMDR therapy. So what is it? What would it be called? So there are a lot of things that go into it. But like I said, yeah, if whatever I'm able to put up, as in this phase of transition, whatever I'm able to come up with, I will let people know. So if you're interested, just follow me. When you go on my page, you can sign up for a newsletter. People that sign up for the newsletter, they'll be the first to know of whatever I do next with my career. Yeah.
Nice. We gotta follow Alice for more because I want to sign up for some of this EMDR. Rewire this brain here. Much needed. And wouldn't that be so cool that at some point, maybe hopefully someday, this can be services that we are establishing clinics in Ghana to offer some of the services and start
Yeah.
some of the
Training
colleges
people.
training.
Yeah. So I'm trying to go through my EMDR certification. So there are different levels of EMDR. So you have to get a certification, then you could be a consultant in training, then you could be a consultant. That's when you can train and then supervise people. So
So needed.
yeah.
Colleges and our universities in Ghana, and we don't talk, we didn't even touch on like this is so broad. We need to talk about postpartum. A lot of women going through the trauma of birthing, trauma of pregnancy, losing a baby, everything in between, having a premature baby. All those things are very or having to deal with a gynecological issue. I remember when I was
Mhm.
young, dealing with fibroids and having
Yeah.
have infertility was a whole big deal. Took me many moons to go through all those things, accumulations of trauma. But yeah, it would be so awesome. Guys, follow Alice, check her on her page. She's doing a lot of amazing work, a lot of collaborative work, which I love a lot, especially in Ghana, where we need to like start doing this work to normalize mental health overall. I mean, everything discussion at a dining table.
Yeah.
What happens to someone though who doesn't, let's say, doesn't process trauma, doesn't deal with their mental health in the long term? What do you think will be the impact? If
So, yeah, top class. Thank you for all the suggestions.
all right.
I mean, I've been in kind of corporate spaces and 9 to 5 settings. And I could say, as a Black woman, it's not good for my mental health. So I don't know. Again, I don't know if I'm going to be in a school, in a hospital, but I have
Right.
found those places to be hostile at times, especially when you are in leadership and stuff like that. It can be really difficult. So, I mean, the reality is, it's not everyone who is going to get to process their trauma or
I'll just be
get to
there.
go to therapy or get the gift. Yeah, yes, I've been doing that. Get the gift of healing. It's not
It's like
everyone,
a feeling. I'll be
right? But
there.
Um, there is a saying. It's funny. It says that when people are dead, they don't know they are dead. It's the people that are alive that they know they are dead, right? And then somebody translated it's to when people are stupid, they don't know that they are stupid. It's the people that have to deal with them.
Yeah, no, that's
That suffer, right? It's the people that who have to deal with them. They are the ones that suffer. So if you don't like heal, maybe you will live in your ignorance and you be like, ignorance is a bliss, but it's the people that have to deal with you. And if
fun.
unfortunately you bring children into the world, then you are going to you get to pass your trauma on to somebody else and your trauma just keep multiplying, right? So that's yeah.
Yes. There has to be a certification process, I think, going into marriage to certify if you're going to be a good candidate. That's why I started today's live. We're talking about parenting styles, the ignorance. There's no gentle parenting that goes on at all in our household. Or maybe it's a little different now in 2025, but for the most part,
Yeah.
that same thing carries on, just like you
Yeah.
mentioned, keeps getting passed along.
Yeah, and I think also, right, we are also in a very critical time, right? Of course, gentle, right? We are the ones that, let's say, our parents, they traumatize us or they were too stiff on
Right.
us or whatever that looks like, right? So we want to do something different. But I think also when people sometimes people's trauma also pushes them to the other end of it where they are too they are not parenting, right? They are not parenting. There is no structure, there is no supervision, there is no, they could give the attention, but there is no structure that whatever a child wants, they get. A child can talk to anybody how they want, that they are not teaching them any skills to navigate the world, right? They are not really guiding them in a way. So I think when people think about gentle parenting, that's where they go. That, oh, gentle parenting is just letting kids do whatever they
Yeah.
want. But that's not it, right? Listening to your child isn't a wrong thing, right? Children have opinions, right? Letting children know you can ask questions, right? You can be curious that if somebody says something to you, it doesn't matter whether they are an adult or whoever they are, you get to ask them, can you explain to me, or I don't understand what you mean, or in my home this isn't how we do things, but can you explain to me why you do this, or
Yeah.
my nieces and my nephews, we talk. Sometimes they'll tell me, Auntie Alice, I don't agree with you. And sometimes I'm like, I know what I'm saying, I'm the adult here, but I want to listen to you.
Uh,
But if you want me to get you a matcha, you have to listen to me.
Where in Ghana they'll say things like, well, I speak a little Yoruba, they'll say, Jing, Jing, Jing.
Yeah.
Like just like you were just being dismissed. Like your voice doesn't matter. You're supposed to be seen, and
Yeah.
children are just like pieces or maybe furniture in the home.
Yeah. They're like props to your life, but we don't know how powerful that is when you let your child speak, you listen to them. Even if it doesn't make sense, right? Me chatting with my 3-year-old or my 2-year-old niece or nephew, what are we going to talk about? Some of the stuff they say doesn't make sense, but it's also for them to know, hey, I am interested in you, right? There is somebody at home who is so interested in you, who sees you, who values what you say, right? So that, let's say, when you go out there, right? If it's a girl, when you go out there and a boy is showing interest in you, it's like a tiny interest that they're showing, like, I don't really care. I have people at home that will listen to me, will listen to me just yap their ears off, or you can no, you cannot tell me I shouldn't have a voice. I know my opinions matter. Even if you disagree with me, I still get to speak, right? If you're raising black girls, that you help them to be assertive so that they can advocate for themselves, right? That when something is being done to them at school, in the workplace, they can stand up for themselves and be like, hey, you cannot treat me that way. Or I see what you did, and maybe you interrupted me when I'm speaking, or you didn't listen to me when I spoke to you, but this is what matters, right? Even when they go to the hospital, they can tell a doctor, hey, this
Right.
is my pain, right? I am telling you how I am feeling in this moment. You don't get to say my pain is valid or it's not valid. So those little things really matter, and it helps build um children up. We often say like the antidote to trauma is really connection, right? It's really connection. It's really to be seen, to be heard, to be valued, to know that you belong, right? Of course, we cannot prevent all the world trauma, but the trauma and the stress shouldn't be more than the all the things that build resilience, all the things that make a person know you're loved, you're cared about, right? When I mean, just even imagine you as an adult, when let's say a friend or a partner tells you, I love you, or you look beautiful today. That day when you go out there into the world, it's like you cannot tell me anything.
You're on top of the world.
You're on
Yes.
top of the world, right, right. And all they did is just to say maybe one word into your life, and you're like, you cannot. When you step into work, even if it's your boss, you're like,
You're
face your
walking.
front. Right. And it really shows, right? For me, I am lucky that my parents are my friends, right? My dad is my friend, right? Whenever, especially in dating situations and I'm having difficulties and I'm like, should I break up with this person? And I call my dad and he's like, leave that person. I'm like, okay. I go right quick. I'm like,
Right?
I'm leaving. I'm
Validate.
leaving.
Yeah.
Right? Bye. I'm leaving. Like, I'm like, my dad said I should leave. And they'll be like, you are an adult. I'm like, yeah, but my dad said I should leave you. So I'm going to leave you. Okay.
Yeah.
Bye. And
Yeah,
not
red
feel any.
flag.
Yeah, so we really need that, right?
Yeah.
Needing those people. And for parents, they have to know that they are those first people for their children before their children step out into the world, before they
Right.
have friends, before they go to school, before they go into the society and meet other people. Parents are those first people for their children. And they also have to know that children do a lot for them to be liked by their parents, that they will do anything for the parent to say, I love you, I care about you, I'm proud of you. Like, we still have adults who are still waiting for their parents to say, I love
Oh
you
my
or I'm proud
gosh.
of you. Right? And people are still holding on to that, right? Still holding on, waiting for their parents to say, I'm sorry, or forgive me, or I was wrong. And, still holding on to that and going into relationships with that and looking for that kind of validation, looking for that kind of approval in all the wrong places where it could have just been a parent to say, hey, I'm proud of you. You're doing well in life. Right?
That's
So
beautiful.
parents
That makes
play a very big deal that they should really know and know that they really matter in their children's life.
Maybe just one solid, consistent, present parent who's carrying that, I think is so important.
Mm-hmm,
Yes,
mm-hmm.
two is awesome and is great, but one solid caregiver, I mean, sometimes it's not a parent, it can be a
Yeah,
caregiver, a
yeah,
grandparent, an uncle, but that
yeah.
consistent
A
love.
school teacher, a community member. Yeah.
True. Yeah, parent from a hot place. And
Mm-hmm.
that's what the work of parenting is. And that's where in our society, there can be a lot of that being absent. This is why there's a big number of people from our culture that are now, I don't know, sort of Gen Z, having this whole going no contact or, you know, but, does it solve it? I think we talked a little bit about reparenting ourselves. What was that there? How can
Mm-hmm.
you provide that to yourself now without feeling like you have to completely block out your parent?
Mm-hmm.
Is that the solution? Or
Mm-hmm.
if not that solution, you're still contacting them, but you're waiting, like you said, waiting for that apology, that word. But how can we do that? How can we give that to ourselves so we can continue to live a wholesome life? And then if you're looking to have children, how do we do it better than
Mm-hmm.
not having to have the cycle?
Yeah,
Repeat.
so I I mean, props to the people who are going no contact if you're a Ghanaian, because Ghanaian parents going no contact can be difficult because they will call a cousin, they will call an uncle, everybody would know you're not talking to your parents, like you are the most hideous child in the
Rebellious.
world, so ungrateful, and they did all of these things for you, and you are just being so ungrateful. But
Right there.
there are also certain situations that the best for people is to go no contact, right? Especially in instances of abuse, a whole bunch of things that it would be good for people to go no contact. So one of the things is therapy. I think we all, as Africans, we all will benefit from therapy. At least if it's a year or 6 months, just go sit, talk to somebody, right? Um, because if we take TikTok as a community and you see our behavior online, um, it's so it's like a symptom of something that's it's a symptom of something that everyone, right? And me saying go to therapy, I'm not saying you are crazy, or I'm not saying, like, just go to understand yourself, right?
Patterns.
Go, yeah, go to understand yourself. Go to understand your childhood. That's why I said 6 months. You could go 6 months and you're like, okay, or it could even be 3 months. I understand my childhood. I don't have any trauma. I am good. That's fine. However, most of the time, that's not the case. I would have people, they would be like, okay, Alice, I said I was going to come see you for 3 months and I'll be fixed. And then they were like, but it's been 3 years and I don't even know if we would ever.
Sometimes it's a lifelong journey and it's okay.
Yeah. And the more they get into it, they're like, Alice, I don't think we are ever gonna break up. We are stuck.
Oh,
Yes.
but guys, when you start therapy, though, I remember my first time doing therapy. Well, I've dated a couple, not dated for real, but dated because I check out my
Yeah.
therapist.
Hmm.
But my first, I think she got very overwhelmed by because I was like, no! I was like, saying this and that, and this happened, and she's like, she just ghosted me. I'm like, but you can experience that too, so you don't get discouraged. I'm saying that
Hmm.
when you're speaking, when you're having these conversations, depending on how much you've accumulated, depending on who the therapist is, don't get discouraged if it doesn't align right away.
Yeah. Yeah.
Just
Yeah.
to
You have to shop around, right? And it's okay
yes.
to break up with your therapist, right? It's okay to be like, I as a
Or get
therapist.
slack with them.
Yeah, I love it when a client comes to me like, Alice, I don't think we're a good fit. I'm like, good. You are advocating for yourself. You know what you want, and we are not a good fit, and that's fine because all therapists are not the same. We are different. So I have had multiple therapists. Some worked for me, some didn't work for me. Um, some I've needed for me, maybe because I know what I want. I I know I needed different therapists at different intervals in my life. So I'll be like, sometimes it could be a male therapist. Sometimes I'll be like, I need a male therapist. Sometimes it's like I need a female therapist. Oh, I need this person and all of that. So really, really, therapy is it's a relationship, right? So if it's somebody that you feel like I cannot be myself with, or I tell people, do you see yourself growing with this person? Because of course, your first session, I'm not expecting you to tell me everything about your life in the first session, but can you, when you sit down after the first session, can you see yourself like, I think I can grow with this person. I think I could do some sort of a long-term relationship with this person, or I could see us getting along and all of that. So it's okay to change therapists. It's okay to shop around for therapists. It's okay to also break up with your therapist. It's completely understood. So I say at least 3 months, at least 6 months. Everybody should experience what it means to sit at the other side of it, and have somebody listen, like unpack your brain, right? It's like your brain, you're just opening your brain and you're pulling things out little by little. And sometimes you pull something out, it's like, this is not needed. Okay, let's throw it away. Maybe we need this, we need something new, let's bring it in. So therapy is really, really important. And I think, especially if you're also talking about children and parenting, we also have to know that parenting is a choice, right? It's not a
Yes.
must. It's not a
Right.
must for everybody to be a parent. It's a
Right.
choice. It is a
Right.
choice. You are choosing to do this. Children don't ask to be born.
Yes.
Children do not make the decision of being in this world. So it is very important for you to do some sort of self reflection, to really think about it. Am I ready? Can I do this? Right? And I often tell women it's important to think, can I do it alone? Right? Of course, you may have a partner who is very supportive, who is all of these things, but life can happen, right? Sickness, tragedy of this world, right? You may have the most lovely person, but life circumstances could make you a single mother. So, can you do it alone, financially, emotionally? Do you have a community of people that would support you as well? Not just, even if you are with a partner, not just the partner, but do you have people? Do you have friends? Do you have people that can step in, right? Do you have people it's that can open your child's world, that they see different kinds of people, that it's not only you raising them, but they also have other positive role models, positive people around them, so that they can be a well-rounded individual. So parenting isn't, it's not just about bringing the child into the world, right? um and also to know that there are also different ways of being a parent. I think in our Ghanaian community, we only focus on the biological aspect of it, but there are so many pathways to being a parent, that for some women, actually taking the biological route can be detrimental to their mental health or to their physical health. So it could be adoption, right? It could be fostering. It could be so many different ways that we have to welcome it and not shame people who, say, hey, I have seen clients who are living with chronic depression, and sometimes their gynecologist will tell them, hey, I'm worried about postpartum for you, that maybe getting pregnant, even pregnancy, having a child, your hormones, we don't know what's going to happen. So it may not be right for you. Do you have money for surrogacy? If you don't, then you can do it. You can choose to do it, but then it means we really have to prep for your mental health and all of those things. So it's it's again, it's a choice that we have to leave people alone and let them decide. And also, when you decide to do it, knowing that it's a lifelong process. Like it's a lifelong commitment that you are getting into, that it's not easy. You are responsible for another human, making sure that they are set, right? Um, you are not doing them a favor. You are not doing your children a favor because you decided to do this. So it's not a favor that you are doing them. They didn't beg you to be born. Even if you adopt a child, the child didn't beg you. You made that choice to adopt the child. So I think it's very important. And then before you become that parent, you have to do some self-reflection. And it's important. And then before you become that parent, you have to do some self-reflection and see logically, physically prepared to have a child. Because again, I have seen at times that children really trigger parents, that children will really trigger
Mm.
parents' childhood trauma, their own trauma. Some parents can they see the life that their children have, and it brings about a lot of grief and a lot of sadness for them, that why couldn't somebody love me like this, or like this is my child, I can never do anything wrong with them, and how could my parents do what they did to me. And it could really be difficult for people to reconcile. So being prepared for all of these things, being prepared for the unknown, a lot of the unknowns, which is why again it's very important that people prepare and know that it's a choice, right? It's a choice, that it's not by force. Yeah.
It's not. And so parents who might not even align temperament wise with their kids, children who might, they're batting heads a lot, but a lot of time it's not because what dear kind of thing or bully kind of thing, but it's because
Yeah.
the temperament is so different from the parent.
Mm-hmm.
And also, not to talk about, kids who are born with disabilities and the grief that can come with the
Yeah.
parent expectation of what we're going to get. And then, but the fact is, when you see it, there's help. That's why, like, this conversation is so, like, so important. The fact that you noticing is so key. And then knowing that there is help. Let's say you have a child who you are mal aligned with temperament wise, knowing that that's what it is. It's not that child is so stubborn. You're gonna break that child's spirit first of all, because they are not your same temperament. That doesn't mean they're a bad child. There's no bad kid first of all, and it's your choice you made. You lay down sometimes, maybe even it's an oopsie, you still make that decision.
Yeah. Yeah.
Protection and
Yeah.
fear. So
Mm-hmm.
how do you show up from a hard place? Um, like little bits of stories. Iyanla, who I follow a lot, told the story about her son who ended up being incarcerated, had a lot of trouble. But she's talking about her story from hindsight. She does a lot of this work. And she was, talking to women about the importance of parents, especially when you're talking about boy children, even in therapy. One of the things that popped in my mind is like, how many women versus men do you see in the therapy room in that safe space, especially from
Mm-hmm.
our culture?
Mm-hmm.
But she was talking about how she regretted, regretful parents. There's this there. She couldn't parent him from a heart place, more from a duty place. So anytime she sees the son, go do this, duty, all that, all like the fact is like you see a child just sitting, chilling on a Friday evening or night, like why are you over there? Did you clean your room? Did you do this? It's almost always text is not from a heart place. Oh honey, oh my love, oh there's no that touch. So what are your, as we ease towards kind of ending, wrapping up our life, what have you seen the discrepancy between genders, especially in our culture,
Yeah.
in your therapy space, and regarding the choice, the temperament,
Yeah.
like what do you see with, parent-child relationship when it comes to temperaments and disability, things like that? It's
Yeah.
a lot of
So
grief that comes.
I see more women than men, and that goes with the statistics. More women seek help.
Wow, of course.
However, when it comes to unalive, more men unalive themselves, or more men struggle with depression. But I have seen that, and the men that come to therapy, I mean, from the men that I see, they are really like men who are really dedicated to coming to therapy, dedicated to understanding themselves, dedicated to being better, whether they are parents or their partners or just navigating life. There, I have also seen that almost all the men that I see have experienced some sort of childhood sexual assault as well. Something that is very rampant, but we don't talk about that. A lot of men, their first experiences was during childhood, so they were violated in a way, and so sometimes that also becomes a template for them in what it means, what intimacy means, right, and how they approach relationships as well. So when it comes to, I think, parents and your children, I think one thing that parents have to know is that your child isn't going to be like you, right? If you have five children, you're going to have five different human beings at home. And that means that you have to cater to five different people. It's not a one size fit all. That's why sometimes therapists or psychologists will really caution people against having multiple children or a lot of children, because maybe financially you can take care of them, but emotionally and psychologically, can you take care of them? Because you're dealing with different personalities. So one child may like drawing, one child may like painting. You have to make equal time for each of them. Just because you're like, oh, that it will be easy for me to put you all in painting, but they're the child who doesn't like painting, then what happens to them, right? So you have to adjust yourself to every child's needs and their wants. You may have a child who is introvert. You have to adjust to their need. What do they need, right? Do they need an alone space for themselves sometimes? Do they need maybe for you to help them out, making friends and then stuff like that? Then you may have a child who is extrovert, who is talking to everybody. Then you have to adjust to their needs as well. So you may have a child who it can be very melancholic, right? So, some people come like that, low serotonin, low dopamine levels. That's how their biological makeup, that's how they come. So you may have to attend to them. Then you may then, if there are children with neurological, developmental, other sort of issues, you have to adjust to them as well. So as much as you make a choice to have children, you also don't get to choose the child that you have. And children also come with their own biological makeup, their own attitudes, their own beliefs. And then when it gets to puberty and adolescence, now there are girls as young as 9, 8 having their period. So that means that they are dealing with hormonal changes. They are being irritable. My adolescents, when they come in, they are irritable. When they get their period, they don't want to talk to me sometimes. Sometimes they'll be so mean to me, and I'm like, why are you being so mean? Somebody would ask me, I would say something, they'll be like, are you sure you're really a therapist? I'm like, hmm.
These days, I'm
I'm like,
telling
you're
you,
lucky you're a child. Like,
that's that's the part. Oh
You're
my
lucky
God.
you're a child. Like, what do you mean? They can be so mean and so callous. Like, they will go right into it. So then you have to deal with, the puberty, the adolescence age, helping them understand their body because their body is going through a lot of changes that they don't understand. So if you have five children at home, you're going to have to do all of that. You're going to have to do all of that. So again, you are not your child. Your child isn't going to be like you. If you like rice, your child may not like rice. They are not going to be like you, which is why it's also important that parents recognize their children's interests, their children's strengths, and help them build on those strengths, right? Help them build like you. That's why you have to see your child and to value them. Oh, I see that you like reading. Okay, let's go to the library or let's go to the bookstore. Let's pick up books. What are you reading? Tell me about the books that you're reading. Oh, I see that you like fixing stuff. Okay, I will get you stuff to fix. I see that you like doing this. Okay, so always building their interest, whatever they are interested in. And also, children go through phases, so their interests can change, but it is up to you, the parent, to support them along all those because you don't know which one is going to stick, right? Because they are trying out new things, right? I have some kids that every day he comes in with a different hair color.
Right.
And I'm like, the parents, they must be tired. But someday he'll be in with pink, someday he'll be in with this, and the parents is like, yeah,
That's the
that's
order.
fine, Alice. I'm like, okay, I love it. You are supporting it. I love it. You are supporting it. But again, that in a way that parent is also letting that child express themselves, right? Like if you want to wear pink hair, do it. That's like the least of my problems as a as a
See?
parent. So again, you have to be present, and there are times that of course disability, or sometimes we will say differently able, will present its
Yep.
own challenges or its own problems that you have to be there because you are parents. You have to adjust your schedule, you have to adjust who you are. Finances, it could take a toll on your finances, it could take a toll on your work schedule, um, all of these things, right? So it's difficult, which is why again it's important that you have a community of people. If you're not going to do it with a partner, you have a community of people. If you're going to do it with a partner, especially with the women, you have to make sure you're not a married single mother.
That part. We get that wrong a lot, but yes, that part too.
Yeah, you have to make sure you're not like a married single mother. Then it's like you have to make sure that it's like we are in this together. Like I cannot do it alone, right? I cannot do it alone. And for me, a little bit about when I date people, that's one of the things I taught. I'm like, I don't have kids because I cannot do it alone. So don't depend on me to be raising your children for you. You may have to raise me and raise your children as well. So it's not easy here. So really, like we as women, sometimes we have to put those things down. Like, hey, I cannot do it alone. I am not like a superwoman, or I can't. So either you are in, or we are not having kids, or we are not doing that. So I think it's very
Right.
important. Yeah.
Knowing that it's okay to have that voice. And I think that's where we as Ghanaian women, especially, I'm using that particular verbiage because sometimes we think it's disrespectful or it's not our place to, just like the question, to own our preferences, like to
Hmm.
know ourselves so well, our patterns so well, our bandwidth so well that we're able to advocate for ourselves and say, oh yeah, no, that's a red flag, or that might be too much for me, and
Hmm.
saying, hey, I might need more help than what you're talking about. So therefore,
Hmm.
if that's it, then okay, bye.
Yeah.
I'll go going on to next and having that
Hmm.
abundance mindset is so critical, because the thing that happens is that because we're, many of us as so engulfed in the church community and stuff like that, it's like age related stuff, like,
Okay.
milestones, like, okay, we have to get married by the age of 25 or 27. Okay, so then we have to do it. So you're doing it, but you're not vetting that person. Do we go to
Mhm.
therapy do we go to therapy to seek perspective? Are we even going to work together? How does it look like if the people change? I change, I gain weight, or my
Mhm.
if I get into my premenopausal age, if I get this and that. Are you ready for all that? But we get
Yeah.
in there just for the sake of it's something to do at a certain age, and
Yeah.
then we did it. Now, okay, after that, the expectation, I doing one that somebody put a comment in my things like, oh, I didn't know there were people called womb watchers. The womb watchers, now you've accomplished that first steps, and I'm like, oh, when are you gonna start having children? So you have one child, so they're gonna be like, so when are you having the second one?
Second
Like,
child. Yeah.
another one. So then because of pressure, in our communities, you go and have a second one, and you don't know how that second one is going to be like. And that's when things start to happen, and, life happens, and who knows. But this is why we're having this conversation, to normalize the fact that I love the fact that you see kids. I myself had to go to therapy. My kids had to go to therapy. You're going through life transitions, or you have a
Mhm.
kid, or you have a parent who is sick a lot, who has
Mhm.
chronic condition. You have to go to therapy to seek that support. That support cannot be just, like, what happens in this home stays in this home. We don't air dirty laundry.
Yeah.
That's quick recipe for
Mhm.
crashing hard or re-traumatizing ourselves. So I mean, tonight's conversation has been like, we can sit here all the way till midnight, I think, just carrying on and on about it's amazing, amazing stuff. So where can we find you? Where can we like, if you're looking to get your services, to get a clone of you?
Yeah.
I'm
So
always
you
looking
can.
for a therapist.
Yeah. For now, like I said, I'm licensed in
Yeah.
New York and Ohio. You can find me on my page. If you go to my page, I have a link tree. It has so many different links on all the things that you want to do. If you want to collaborate on a podcast, speaking engagement, everything is there. You can do that. Sign up for a newsletter is there, those kind of things. Yeah, I'm on Instagram, is the same username. It hasn't changed. So Instagram, TikTok, YouTube. I don't really do YouTube that much, but I'm on YouTube. I'll be having a podcast out soon with Dr. Louis. So we'll be talking about mental health and
He's
stuff.
doing a little
So
he's amazing. ADHD. ADHD. Well, some of us with the
yeah,
ADHD. I
yeah,
don't know.
yeah,
My daughter's diagnosed, so I know most likely have ADHD. So now I
yeah,
give myself a lot of grace. But he's another one that I binge watches stuff. I'm like, oh my god.
yeah,
Especially in our Ghanaian community, especially the
yeah,
we girls, like we've conditioned ourselves to navigate our ADHD symptoms so
yeah.
well. It's not
Hmm.
disruptive, but
Yeah.
over time you can sense the balls are dropping. Soon after that, oh my god, I can't wait to check out the podcast.
Yeah.
Love it
Yeah.
so much.
So definitely you can just keep an eye on my page and everything that happens. It will be dropped there. Yeah.
I love that. Oh my
Yeah. And
god.
thank you for having me. I really appreciate it. Yeah.
Thank you for having this time here tonight talking about parenting. I'm looking at the time like 9 o'clock. If I see this is the if I didn't have I was sitting here chatting and going on and on. My kids sound oh yeah, they're here. But oh my god. Thank you so much. So grateful. I appreciate your time. All the nuggets that you dropped on us, nothing can replace that. Telling us all about EMDR. I'm gonna catch you again for another one, maybe in the times, maybe in the summer or something, to get another conversation about mental health in our Ghanaian community, in Ghana especially, because these are conversations that are so needed to normalize it, to have it, to liberate someone. Listen. Some of us are struggling, but many of us are struggling in silence and wishing things to just vanish or go away. But coming to a safe space with someone like Alice and sitting, getting validated, getting supported, listen, it prevents, even if one person getting unalive or unaliving themselves, is a life that's saved. I've seen people inpatient, one-on-one care. These are real life things that are happening to people. But how do we cope? How do we support each other? How do we normalize it? How do we say, oh my God, you are too much, you're too weak. Go and pray about it.
Mm.
You fast, yeah. But yeah, thank you so much for your time, and hopefully, we'll do another one soon.
Yes, 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 definitely. Thank you and have a good night and a great weekend, everyone.
Guys, thank you so much. I appreciate you joining me